health care is one of the most rapidly growing industries in the United States. Much of this growth has occurred as a result of efforts to control costs in medical care. One way to cut costs is to have the patients discharged from the hospital quicker, and as they say, oftentimes quicker and sicker. An increasing number of patients are being treated in the home by a home health agency. Home health care provides quality medical care in the privacy and security of the home. Hi, I'm Kathy Gettrist. I'm an instructor in community health, and today we're going to be talking about what is involved in a home visit for a home health aide. Home health, much like hospitals and long-term care facilities, has a Bill of Rights. This Bill of Rights lists the basic rights to which all patients receiving home health care are entitled, such things as being treated with dignity, consideration, and respect, having their property treated with respect, or knowing in advance if the individual is going to be responsible for any payment of the home health services. This document is given to the patient by the professional nurse on admission to home health services. It must be signed by the patient, or in the event the patient is not cognitively responsible, by another individual in the family, that they have received the Bill of Rights and also that they understand it. Confidentiality is a major issue in home health. You see and hear things as a home health aide that the family considers private. Things such as being aware of their personal mail, serious arguments that might be going on between family members, can all be information that you are privy to. The Health Insurance Portability and Accountability Act, also called HIPAA, is the act that protects the privacy rights of patients in the home as they do in hospital or other medical facility. It also allows for a limited access to confidential information of healthcare workers. It's very important not to discuss with anyone other than your nursing supervisor or other individual that is involved in the care of this patient any of the information that you become aware of in the course of your being in the home. Never disturb patients' belongings. If you need to move things to provide the care, be sure that they are put back exactly where they were. This is particularly important with people who have low vision or are blind. They become very reliant on exactly where things are at, and disturbing that can cause injury to them. Always work within the limits of the care plan and the home health assignment sheet. These forms would be found in a folder that the nurse has placed in the home. The assignment sheet would tell you, the home health aide, exactly what it is that you are to do while you are there. Now I'd like to spend a little bit of time talking about the home visit itself. Your personal safety or the safety of any other caregiver in the home is always a concern. Be very alert to conditions and people in the area where you are visiting. Map out the route in advance and call the patient to inform them of your arrival time. Lock your purse and any other valuables in the trunk of the car for safety. Always be sure to wear the name badge that shows your identity and the agency for which you are working. If you are in a dangerous area, it might be a good idea to make joint visits with another co-worker or have an escort that would go with you. Always keep a full gas tank and avoid parking on deserted streets. For safety's sake, also keep a cell phone with you. This may be provided by the home health agency, or you may be reimbursed for use of your own cell phone. Once you get to the home, infection control is probably the most important thing. This means that you need to wash your hands frequently, much as you have learned to do in the hospital or long-term care setting. Unless your hands are visibly soiled from something that from dirt or other item on your hands, it's better in the home if you not use bar soap that the patient has, but rather the agency will provide you with a waterless foam or gel that you would put on your hands a small amount and rub in and interlace your fingers much like you would be washing your hands with soap and water. Use standard precautions if you come in contact with blood, body fluids, mucous membranes, or non-intact skin. Always maintain a clean environment. You will probably be provided with your home health agency medical bag that has in it some of the supplies that you would need to care for this patient. It might include